It's Wednesday morning. At the National Institute of Allergy and Infectious Diseases, class is in session. Tony Fauci explains how to persuade a president.
You go in there and you say, I need to talk to you about this particular issue. These are the problems. 1, 2, 3. This is what I think you can do about it. 1, 2, 3.
He would know.
So this is when Clinton came to the...
For the last 5 presidents, Tony Fauci has been America's point man against the infectious diseases of our time. He was a street-savvy kid from Brooklyn, captain of the basketball team. No surprise, he was point guard. Soon, Dr. Tony Fauci joined the National Institutes of Health, where his team cured a fatal inflammatory disease. He was smart, articulate, and passionate, and would soon need all 3.
When HIV/AIDS started, it was scary and extremely dark. Virtually every patient I saw within a relatively short period of time died, and died a terrible death. It's your mandate to do something about it.
His colleagues warned that AIDS was a career buster, but Tony's lab focused on it. He opened an AIDS clinic. He'd found his cause. Jeff Bluestone was a fellow researcher and today is UCSF's executive vice chancellor and provost.
My biggest memories of Tony in those early days is getting up in front of large groups and talking with a passionate voice about how important this new healthcare problem was.
But this voice also listened. When AIDS activists stormed Tony's institute demanding action, he made headlines by inviting them in to talk. By 1986, Tony was director of the National Institute of Allergy and Infectious Diseases. His honesty made headlines. After the FDA rejected a new AIDS drug, Tony was grilled by a new congresswoman from an AIDS-ravaged district, Nancy Pelosi.
And I asked him, I said, Dr. Fauci, if your child was affected by HIV/AIDS, would you use this drug? And he said yes. Well, that was very courageous.
Within the next 48 hours, the Eastern Hemisphere...
With AIDS, Tony Fauci was creating a model for America's response to any health threat. And so when the 21st century brought bioterrorism, SARS, West Nile virus, time and again, Tony rallied the team.
We underestimate how many different types of people he's been able to bring together, from industry, from the private enterprise, from the NIH and the government at large, to tackle these big problems. And the U.S. has been able to make an enormous difference worldwide.
The best example, Tony designed PEPFAR, a multi-billion-dollar U.S.-led partnership of nations fighting against HIV/AIDS. Tony calls it his biggest accomplishment.
If you look at the impact of PEPFAR now with millions of people on therapy and millions of lives saved, I cannot imagine saying that there's anything else but that.
But equally remarkable is how many other ways Tony Fauci advanced science behind those headlines.
For me, one of the biggest impacts he's had in a totally different field of immunology, that of organ transplantation, so that patients come in with the prospect of being dead in 24 hours and a week later they walk out of the hospital with a new liver.
This is ground zero.
The AIDS ward is closed now, but for all the progress, Tony is still haunted by the ones he couldn't save.
And as a physician, that's the scorecard. And the scorecard was really, really bad for years.
You paid a price.
Yeah.
Personally?
Yeah.
He could have given up, and no one would have blamed him, except himself.
I just see him as a bright and shining star, that we were blessed to have him in the position of leadership that he had at the time, and that he stayed with it. He stayed with it all of these years, and he made such a tremendous difference.